Hey, welcome back, and we're going to talk about immunotherapy. So, cancer treatment has progressed over the centuries from surgical resection or just cutting it out. From I think that was around 3000 BC was the first records of the Egyptians actually finding what we would call cancer and then cutting it out, to radiation therapy, chemotherapy, targeted drug therapy, and of course, immunotherapy. Cancer immunotherapy basically reactivates the body's immune system to produce anti cancer effects to eliminate cancerous tumor cells. But first, what is the immune system? The immune system is a complex network of cells, tissues, and organs in the body that work together to defend against harmful pathogens such as bacteria, virus, fungus, parasites, and its main function is to recognize and destroy these foreign invaders while also distinguishing them from the body's own healthy or native cells. So, what is immunotherapy then? Immunotherapy is a type of cancer treatment that helps your immune system fight cancer. As cancer has a really sneaky way of camouflaging itself or hiding in plain sight from the immune system, a therapy had to be developed that would in effect strip away the camouflage and keep the cancer cells from turning off the immunotherapy cells. Because that's kind of what immunotherapy cells do. They join up with something that it tends to be suspicious, and there's an off switch that the immunotherapy cells sense or detect, and they're like, oh, okay, yeah, you're safe. Move on, carry on with your duty. I'm going to go look for something else. And away they go. Cancer has a very nasty, sneaky way of replicating those in high numbers so that the immunotherapy cell recognizes that as a native cell and allows it to continue on its way. So, the way it does that is through something called immune checkpoint inhibitors, or just checkpoint inhibitors. And they do exactly that. They check the immune system to stop it from attacking the native cells or those cells that belong in the body. Basically, they turn off the immune system in regards to those cells. And so we have to find a way to get the immune system to ignore the checkpoints and continue the attack on the cancer cells while keeping the native cells safe. And how do we do that? Well, very simple. We design a checkpoint inhibitor to block the binding of the checkpoint proteins and help expose the cancer cells to the immune system. And that will allow the immune system to do what it's designed to do, to identify, kill, and dispose of the damaged and mutated cells, right? That's what we're looking to do. That's not as simple as it sounds. It's not simple at all, actually. Basically, what happens is the T cells, which are the immunotherapy cells, the T cells, have what's called a PD-1 protein, and it binds to the PDL1 protein from the cancer cells. At that point, it says, hey, okay, you're safe. You can move on. I don't need to kill you. I'm going to go do my thing. All right. So, how do we do that? We have to block the PLD1 or the PD1 T cell to allow it. So instead of binding, it skips past it or it ignores it. And then as it binds with the T cell receptor, it says, oh, wait a minute, you don't have a PDL1 cell, or my PD1 cell is not recognizing your PDL1 cell. You're a bad guy. And I'm going to activate cell apoptosis, which is cell death, and let you go ahead and self-destruct. That's what immunotherapy is trying to do. And it is extremely complicated because we have to find a way for that receptors to bind with each other on the cancer cells and start the cell death there instead of the cell death on normal cells. Because if we just let it go and do without the monitoring and without the right coding and tagging and everything, basically you'd be turning the immune system onto yourself with just no checkpoints. And I don't think we'd survive that very long. So that's why this is so extremely complicated. That's why sometimes these things can take 20 years or so to find that right PD1, that PLD or PDL1 receptors to come together, those T cells, to determine if it's cancer, if it's not, if it belongs there, if it doesn't belong there. that's why it always takes so long. That's why this is so terribly complicated. So immunotherapy through the checkpoint inhibitors don't kill the cancer cells. They work by helping the immune system to better find and attack the cancer cells wherever they are in the body. So while it's an effective cancer fighter, it does come at a cost. It can have some serious side effects that you need to be aware of. And these can include swelling, soreness, redness, itchiness, rash, fever, weakness, dizziness, nausea, and vomiting, muscle joint aches, headaches, trouble breathing, low and high blood pressure, swelling, weight gain, heart palpitations, diarrhea, infection, and organ inflammation. So we have to be aware of these side effects. And by being aware that these side effects are possible, just because you use immunotherapy doesn't mean you're going to have all of these side effects. You may not have any of these side effects. It all depends on the type of cancer you have, the type of immunotherapy you're undergoing, how much the drug you have to take in, how often, and the type of person you are, type of body you have. All of these things can combine to determine how well you take these side effects, or if you have any side effects. But we need to be aware of them, because again, like we've talked about before, it comes down to your personal responsibility to know these things. The more you know, the better prepared you are. And it goes back to being prepared. I go back to my own example of mucositis when I had throat cancer. Excuse me. Speaking to the doctor, I was talking about this, just felt like I had a baseball-sized plug of mucus in the back of my throat at night, leaving me gagging, choking at night, not sleeping, etc. And when I explained it to him, I was like, I just keep getting this. And the doctor looks at me and he goes, "Oh yeah, we expected that." I didn't expect that. Nobody had told me anything about it. But again, it's my responsibility to go on and find out what are some of the side effects I can get from my treatments. Just like I really think it's also your responsibility as well. So, and once we've done that, once we're aware of what these side effects can be, we can make informed decisions about our treatment. And it doesn't catch us by surprise. We're like, oh yeah, I kind of expected I was going to get a little sinus congestion. I was going to have a little trouble breathing. I was going to have headaches, nausea, kind of expected this, all right? So that's why we look at this, and that's why we keep up with our side effects. Anyway, that's what immunotherapy does, and that's how it works to fight against cancer. See you next time. See ya.